Why does Farber Center take all of this data, including their medical history, blood pressure, plaque score, radiographs, periodontal charting, and restorative charting?
Well, whether it's 3, 6, 1 year, whatever appointment it may be, we need a full assessment because that's the current health of the patient. So checking their medical health, checking what type of medications they're on, if they're taking vitamins, what their blood pressure reading is, if they do have breakdown in areas or decay occurring in a tooth, or if their plaque index score is extremely high, will relate to the inflammation that's inside their mouth. Because when we have inflammation in one section of the mouth, that bacteria can travel to another section of the mouth, and we want to do our best to prevent that from occurring. And that's why we go through all this assessment prior to scaling the patient's teeth, because we want to show the patient where we need to work on and what areas are unhealthy. After we've done the assessment, we've made a definitive plan of what may need to occur or how we are going to treat the patient. We start by doing their scaling. We begin with an air polisher, which is a device that uses air, water, and some baking soda to remove that stain, that disclosing agent that we placed on the teeth, so we can visually see the teeth when we begin to scale subgingivally, which is underneath the gums, because that's where a lot of the most virulent and dangerous bacteria lies, is underneath the gums tissue. So especially when we have a patient with inflammation, we want to remove that plaque that's underneath the gums as quick and as efficiently as possible. So that's why we do remove that staining first so we can see, and then we diligently use a water instrument, an ultrasonic instrument, to remove any of the hard plaque, and finally scale with our hand instruments so that the patient does have the chance to have some reattachment at home, and we can monitor that inflammation at their next maintenance if we need to.